Thank you very much, Maha, for the kind introduction. Good afternoon, everybody. I'd like to thank ILSI for this opportunity to share some perspectives on Asian dietary patterns and health outcomes. And I declare no conflicts of interest in giving this presentation. I would like to start with giving some insights into the landscape on NCDs in Asia, followed by more detail on giving evidence of dietary patterns and health outcomes relationships in some examples in Asia. As you know, Asia is a vast continent, and with 60% of the world's population, with high growth rate, and of course it has huge diversities in many, many aspects, culturally, economically, and in health status. So for example, if you look at the left-hand column, these are examples of countries, high income, middle income, upper middle, lower middle, and Asia has a big cluster of low-income countries. If you look at the life expectancy at birth, expectedly those higher up have higher life expectancy compared to those lower in this list. However, if you look at the death rates for all NCDs, the figures are almost comparable. So this reconfirms to you that NCDs affect both developed and developing countries. And in terms of the risk for NCDs, whether it's prevalence of raised blood glucose or prevalence of raised blood pressure, you see the figures are relatively close. But for overweight prevalence, the countries lower down here still have somewhat lower levels compared to those higher up. So as we also have been told by the World Health Organization 2014, these NCDs are actually associated very much with behaviors, as we know, one of which is unhealthy dietary practice. And so I will start with providing a couple of evidence on this relationship between dietary patterns and CVD outcomes. In this meta-analysis, which involved 22 studies and also included 6 Asian countries, they evaluated the risk of CVD and were able to identify 2 dietary patterns, so-called prudent or healthy dietary patterns with high loadings for vegetables, fruit, legumes, whole grains, as compared to the Western or so-called unhealthy pattern with higher loadings for red meats, processed meats, refined grains, and so on. Now, dietary patterns, as I used here, as some of you may be aware, is generated from food frequency intake, FFQ questionnaire, and then the principal component analysis is applied. So mathematically, statistically, they will generate a number of food groups reduced from the FFQ list. And so what happens? Well, then they were able to compare the relative risk for CVD, and it was found that with the prudent dietary patterns, the populations on this type of patterns had lower risk for these NCDs. On the other hand, and it's shown here, the pool relative risk is reduced. By comparison, those population groups adhering with the Western dietary patterns had somewhat elevated risk for the CVD, like CVDs, CHD, and stroke. So these results support the evidence of the prudent or healthy pattern as a protective factor for CVD. And another paper, and these were all published just last year, Chang et al., looking at 35 articles, including 9. Again, they generated these 2 dietary patterns, And if you look at this, it's characterized by high intake of vegetables, fruits, and then Western diet with higher loading of meat, sweets, and so on. And again, the prudent diet was associated with the odds ratio of a reduced risk for, in this case, coronary heart disease. And then for those adhering to the Western type, the ratio for this coronary heart disease was somewhat elevated. So there are a couple of other papers in a similar meta-analysis published just last year, but I will now move on to Asia. And here I'm going to show by regions, first East Asia, followed by South Asia, and then Southeast Asia, just for convenience. Now, taking Japan, I thought it was interesting to show the association of dietary patterns and suicides. As you may be aware, Japan ranks quite high among the top 10, especially for men, for suicide rates. And here they used the Japan Public Health Center-based prospective study that was started over 20 years ago. And in the follow-up of about 8-9 years, they had 163 cases of deaths by suicide. And then they had followed up these groups with, again, the dietary intake, and they were able to generate, again, a prudent dietary pattern with this kind of higher intakes of vegetables, fruits, and they found that this kind of diet was associated with a decreased risk of suicide. This is not the isolated such finding, because previous findings of an inverse association between similar dietary patterns and symptoms of depression have been reported in other countries. And the explanation offered by the authors could be that the fruits and vegetables are rich in antioxidant vitamins and folate, and these are known to be involved with the metabolism of chemicals like serotonin in the brain, and therefore could be associated in this manner with the suicide risk. And in this study, they found the westernized dietary pattern and the traditional Japanese dietary pattern not significantly associated with suicide risk. Moving on to yet another study, Shimazu. In this case, they had dietary information collected from 40,000 Japanese men and women aged 40 to 79, follow-up for 7 years. And again, they were able to define the diets, so-called Japanese dietary diet, and animal food, and dairy, fruits, alcohol diet. And in relating to CVD deaths, so they found the Japanese dietary pattern was significantly associated with a decreased risk. Remember, the Japanese dietary pattern higher in soybean products, seaweeds, fruits and vegetables, and green tea. On the other hand, the animal food dietary pattern was significantly associated with increased risk of CVD. And one more study from Japan, Nakamura, in using the 1980 Nippon Data 80 database, which had a huge number of participants, and he used this so-called Japanese reduced salt diet in following up with his participants. And in this reduced salt Japanese diet, scores were given to one of these 7 items, and Tsukumono is pickled cabbage, pickled vegetables. And he found that those on the the low Japanese salt diet had a reduced lower risk of death from all causes. Yeah. Now moving on to China, Kai et al. reported on these dietary patterns and mortality in Chinese women, so-called Shanghai Women's Health Study, which is a huge cohort of 74,000, aged 40 to 70 years, and again follow-up of 5-6 years, and then based on the FFQ again, they had identified vegetable-rich, fruit-rich, meat-rich, and then related again, with the cause of death, and they found the fruit-rich diet had an inverse association with all these CVD mortality, whereas the meat-rich diet, as we had seen in the Japanese case, was associated with increased risk, in this case with diabetes, and also mortality from colorectal cancer. Another study, in this case by Lee, and he had used the national survey data. So across the country, northern region and southern region, he and his team compared the traditional northern dietary pattern characterized by high intakes of refined cereals, rice, noodles, potatoes, salted vegetables, compared to the traditional southern dietary pattern with high intake of vegetables, seafoods, and besides these two, there was a third Western dietary pattern. And interestingly, compared to the traditional southern dietary pattern, which is more healthy, the traditional northern dietary pattern was associated with increased risk of stroke. And the Western dietary pattern was not significantly associated. I must say that in this mathematical approach, it is based on frequency intake and not so much on the amounts. And therefore, so-called Western in this part of the world may not have high amounts of meat and processed meat. And so while the name may be the same, Western dietary pattern, it's not necessarily giving us the same health outcome. And this is to show, reaffirm that stroke prevalence is lower in the southern region and compared to the northern. And moving to Korea, where many reports on high prevalence of metabolic syndrome, and there, based on the National Cancer Center participants, again, traditional dietary pattern based on high vegetables, mushrooms, seaweeds, and then the Western dietary pattern, the prudent dietary pattern. And the most healthy was the prudent dietary pattern, significantly less likely to be having metabolic syndrome compared to and also negatively associated with the criteria for metabolic syndrome. On the other hand, the traditional Western diets were not associated with risk of metabolic syndrome. Again, it depends on the quantities that are of the food that are loaded into because this method, the quantities are not included in the analysis. So the last paper that I am sharing is based on also in Korea, and 26,000 subjects. And here, interestingly, they have different rice eating patterns. White rice by itself, rice cooked with beans, different types of beans, rice cooked with multi-grains, barley, sorghum, and so on, and rice mixed with beans and grains. And the risk for metabolic syndrome was lower in the rice with beans and rice with multi-grain groups compared to white rice by itself. So these are examples of rice cooked with beans and rice cooked with multi-grains. Look very healthy. Moving now to South Asia, I must say in East Asia, there were more publications on this topic, and less so in South Asia. In India, they look at the children based on the Mysore Parthenon study, a birth cohort, And again, 2 dietary patterns identified, snacks and fruits, and the vegetarian diet. And they found, well, the snack and fruit diet means that the children were taking more snacks, fresh fruits, so the sweetened drinks, rice, meat dish, so a mixture of healthy and not so healthy snacks. And then the vegetarian diet based mostly on plant foods. And they found, maybe unexpectedly, the snack and fruit pattern was negatively associated with child adiposity. And the speculation is because it has both healthy and unhealthy components. Now, in West Bengal, the women, 700 women aged 35 years and above, again, they managed to generate 3 different patterns, the vegetarian, and then the third one is the meat, high-fat dairy, and the middle one is based on high-fat, saturated fat, vegetable oil pattern. And as you may expect, the vegetable, fruits, pulses pattern was better, was inversely associated with the cardiovascular biomarkers, total cholesterol, and so on. And then the hydrogenated and saturated fat oil patterns, not so healthy, positively associated with waist circumference and BMI, and so on. Now, in Bangladesh, a study, participants enrolled in 2,000, follow-up for almost 7 years. And again, you have a vegetarian diet and an animal protein diet, and then a diet that is in between, combination of meat and vegetables. And again, the animal protein dietary pattern had a positive association with risk of death from heart disease, especially among ever smokers, whereas the vegetarian diet and the balanced diet were better in terms of the health outcomes. And then the last one from South Asia, in Pakistan, hyperhomocystinemia is a matter of health concern, and so they decided to look at the dietary patterns in relation to this condition. And they generated the prudent diet, as you expect, animal protein diet and strictly vegetarian diet. And indeed, they found protective effect of the prudent diet, which has high plant protein for hyperhomocystinemia, whereas the animal protein diet was more significantly associated with higher homocysteine. And the last region, Southeast Asia, there are just a couple of countries, Thailand and Singapore, that have this kind of analysis done on a sizable population. In Thailand, Ek Plakhon and his team looked at the Thai National Health Examination Survey, which had almost 6,000 adults, middle age, and they had meat pattern, healthy pattern, high carbohydrate pattern with this kind of uploadings of food groups. And the meat pattern was found to be positively associated with higher risk of abdominal obesity, high blood pressure, and hyperglycemia, as compared with the more healthy diets, which had decreased odds of abdominal obesity and hypertriglyceridemia. And indeed, those taking more of the carbohydrate pattern was associated with metabolic syndrome. Moving on to Singapore, since 1993, the Singapore Chinese Health Study has been going on, and they recruited over 60,000 men and women aged 45 to 74 years, And a lot of data have been generated, and more than 70, 80 papers have been published in reputable journals. And I'm sharing with you this very recently published. And this article reported on 10,000 deaths followed from way back 1993 through 2011. And here, if you look at the title, Beverage Habits and Mortality, may sound rather strong to associate mortality with beverage intake, but I guess they have enough data, and so they look at higher coffee, higher black tea intake was okay if you never smoke. Light to moderate alcohol intake was also okay if whether you smoke or not. But if you are a heavy alcohol drinker, then they found that this drinking habit is positively associated with mortality in smokers. Yeah? So the author said smoking creates dysfunction in cellular activity and a pro-carcinogenesis state in which heavy alcohol consumption may exert a strong synergistic carcinogenic effect. And finally, the paper from Singapore, and I thought it was interesting to look at the dietary patterns in association with hip fractures, lower hip fracture risk. So based on this Singapore Chinese health study, two distinct patterns, so-called vegetable, fruit, soy pattern and the meat dim sum pattern. Well, the vegetable, fruit, soy pattern was associated with lower risk of the fracture, whereas the meat dim sum pattern was not associated. So maybe that's good news for many in Asia, because dim sum is a common favorite breakfast and lunch with shrimps and meat and so on. So in my conclusion, at the very outset, I had said that Asia is a vast continent with great diversities in many, many aspects. But as you could see from the evidence published in several regions of the continent, there seems to be some common features in relating dietary patterns with health outcomes. And so, in summarizing from the papers that I had just described, you can see on top Singapore, these are the food items associated with positive health outcomes: vegetables, fruits, soy foods. South China, also rice, vegetables with some meat. Japan, soybean products, fish, seaweeds, vegetables. India, leafy vegetables, pulses. Thailand, beans. Korea, fruits, and so on, nuts. So you see the common features in the diets of Asian countries that are associated positively with health benefits. In contrast, from these countries, from the evidence I showed, again, if you look at China, Shanghai study, meat, animal parts, animal organs, not good. Pakistan, meat, chicken, so it's again related with animal foods. Thailand, red meat, processed meat. Japan, beef. Bangladesh, animal protein. Singapore, chicken, pork, fish, etc. So these findings are, of course, not earth-shattering or unexpected, and indeed quite aligned with the latest report from the World Health Federation that was just published, and it's about food consumption and its impact on CVD and importance of solutions focused on the globalized food system. And what they advocate, what they recommended, that we should make these recommended dietary changes, increase consumption, yeah, and you see the plant-based foods, nuts, legumes, fruits, vegetables high up on the list. Reduce consumption of meats and refined carbs, lower down. And lowest at the bottom, most sustainable diet, plant-based. So I guess if you want to ensure more positive health consequences in life, we need to take cognizance of our dietary patterns to be more plant-based. I guess that's the last slide. Thank you very much.